Hi, this is Dr. Rukmani Choudhary and you are watching Dr. Rukmani's Health Update. My today's topic is myositis. Myositis, so as its name implies, myositis. Myo means muscles, itis means inflammation. So this is a kind of muscular disorder in which you have weak muscles, painful muscles, and there is a swelling. So these are chief symptoms in myositis. And any condition that can cause inflammation in the muscles can cause myositis. This is myositis. What are the causes of myositis? There can be different causes of myositis. Like these can be inflammatory one, these can be post-infective, and these can be post-traumatic, and these can be like after overusing of drugs, interaction of certain medications. So we'll start with inflammatory myositis. The condition, those conditions which are inflammatory, means you have inflammation in your body, and by those conditions you can develop myositis. And these conditions can be dermatomyositis, polymyositis, and certain autoimmune disorder. Autoimmune disorder means disorder in which your own immune system attacks its own tissues, damages its own tissues. So these are like autoimmune disorders. I have created a playlist by the name of autoimmune disorder. Like you can find videos: systemic lupus erythematosus, lupus is there, scleroderma is there, and rheumatoid arthritis. So these are kind of autoimmune disorders in which you have inflammatory condition, means your muscles are inflamed. Infection, you can have infection. These can be bacterial, viral, and fungus. Most common is viral infection. So viral infections are the most common causes myositis. In the virus, you can have even HIV, and there are common cold viruses, there are flu viruses. And the next comes drugs, overuses of drugs, certain even medication interactions. So drugs, these can be like alpha interferon, these can be like colchicine, these can be even alcohol causes myositis, and these are like cocaine. So these are certain drugs and certain medication, and once you start stopping having these drugs and medication, you start seeing difference in your case, means your symptoms disappear gradually after discontinuing all these drugs or medication. Injuries are also blamed for myositis. So post-traumatic injury, you can develop myositis, and these can be like a transient or temporary effect. So once you rest or recovered for a couple of days or couple of weeks, so this is like transient one, temporary one, injury. But yes, you can develop myositis even after in trauma. What symptom? Symptom entirely depends on the types or the causes of myositis. If you're having inflammatory conditions, and after inflammatory conditions you're having myositis, so you may have those disease symptom as well. Suppose you are having any autoimmune disorder, so you're having any autoimmune disorder, you're having overall body inflammation, so you can have all those symptoms. Obviously this is a like muscular inflammation, so you can have difficult swallowing, there is a dysphagia, difficult walking even, and there can be rash on the skin. So these symptoms can be there, and again pain, swelling, and weakness will be there. These three symptoms will be there. So if you're having the inflammatory condition, and you may have other symptom as well of the disease. And the next comes infection. If you have myositis after a viral infection, so you can have like a viral flu-like symptoms. You can have fever, cold, cough, weakness, lethargy. And after injury, so yes, there will be swelling, pain will be there, and once you do rest for certain days, so and you are recovered. So a drug, if you discontinue those drugs, you start seeing change, you start seeing difference in your symptom part. What are the tests required, and how we diagnose, and what is the accurate diagnosis for myositis? There are certain blood tests, and in the blood test your creatine kinase level are increased. So elevated creatine kinase level always indicate muscular problem. There can be certain muscular problem. There can be abnormal antibodies. There can be high level of antibodies. So those indicates an autoimmune disorder. And there is MRI. So MRI scans visualizes your damaged muscles, the affected area, how long it's been, the duration, on certain gaps. This we ask you to go for MRI scans. And there are EMG that determines your strength or weak muscles or damaged muscles, or we can say the confirmatory or accurate diagnosis, that is muscular biopsy. So muscular biopsy is done by taking a small piece of a tissue, and that is a study. So these are like muscular biopsies, but these are advanced tests These are required in some cases. Otherwise, we have to check your symptom, your history, that what can be your history, other problem, or whether it was an infection, viral infection you had in your past, or you had an injury, or you're having other autoimmune disorder. So we have to go in your history, we have to take complete case, and we have to try to find out the root cause, the underlying cause for the better treatment, and you have to give your complete case for better understand. And what is the role of homeopathy in myositis? Different medicine for the different individual in homeopathy, and I always focus that go with your case. Don't buy all medicines not required, not needed. Just go with your case. Just try to collect your symptom. Just try to understand your case. What is individual about you? In homeopathy, there are two main features. That individualization is the one that we have to find an unusual symptom about your case. That is the peculiar, the individualization about you. And one is holistic, means as a whole. We have to consider a case as a whole. Means though you are having chief complaint is myositis, but we have to look other part as well. What are other associated symptoms? At times we have to collect all things, and then there is a diagnosis. So yes, we have to focus on two main features, that one is individualization and the other is holistic. So I'm having certain medication, but again, don't buy all the medicine. And if you're watching on YouTube, you may find all medicines link in description box below. First is a pretty common medicine, and that is frequently prescribed, frequently used, indicated medicine. Kali phosphoricum is given when you are tired. There are muscle exertion is there, and even the mental and the physical exertion. So it covers all the symptoms, and this is in the tablet form, and this is the SBL company. So the place you belong, the form may differ, even the company may differ, but just focus the name that this is Kali phosphoricum. And just try to have 2 or 3 times in a day before having your meal, and just continue minimum 2-3 weeks, or it depends how soon you start seeing difference. So you can even taper down your medicine dose. Phosphorus for non, it's like a weakness property, and it is given in the the weakness cases. The upper limb weakness means you have arm weakness. So in these cases, phosphorus works amazing. In the liquid form, dilution form, and the bigger quantity, go with the smaller quantity, go with the lower dose, and just have 1 or 2 drops direct on tongue orally before having your meal 2-3 times in a day. Capsicum we usually prescribe after certain paralysis or the motor disabilities. So in these kind of cases, particularly for the lower limb, so this works amazing in lower limb. Have smaller quantity, minimum dose 1 or 2 drops twice or thrice. Again, known for its 3D: dizziness, drowsiness, and the dullness. The patient is dull. There is a weakness. So there is a profound weakness. So if weakness is found, though all symptoms are there, pain is there, weakness is there, and swelling is there, but the main symptom is weakness. So if you are weak, if you are lethargic, and you are tired, so in that case you can take Gelsemium. Arnica, pretty common, quite non-Arnica montana, sports person, very pretty common, pretty familiar, and tops the chart. So Arnica is known like for its post-traumatic cases, it is given, but it is like internal injuries, no external injuries, no cuts are there, no laceration is there, only internal injuries. There can be hematoma, there can be the swelling is there, pain is there. So in these kind of cases, Arnica is given. So this comes in all the form, like Arnica ointments are there, Arnica sprays are there. So whichever available, you can buy and you can use accordingly. So Arnica montana in 30 or 200 potency, 1 or 2 drop twice or thrice before having your meal. Rhus Tox is the medicine in homeopathy that is known for working on the connective tissues. So it works on ligaments, tendons, muscles, all the connective tissues. This works amazing. So if you have any kind of the muscular problem, swelling is there, pain is there, the Rhus Tox has the chief symptom, that is pain. So if you have chief pain symptoms, so in that case you can take Rhus Tox. The medicine, there can be other medicine as well, like Ballerina can be there, Stanomat can be there, depending on the individual case history and the patient's past history. This video can give you some amount of help. If you find this video knowledgeable, informative, please like, share, and subscribe my channel for further notification. Thank you for your time. Thank you for watching. Keep watching. Thank you so much.